Hello and welcome to the next video in our wellness series for the Biggest Change Your Competition. This presentation is about something that is often overlooked when we talk about wellness, especially in the college-age population, and that is sleep. College students are not generally early to bed, early to rise people, and they are notorious for not getting enough sleep. With busy schedules, work, and other activities, the easiest thing to give up sometimes is our sleep time. For a typical college student, 7 to 9 hours is the recommended amount, yet 70 to 90% get less than 8 hours per night. Being tired due to lack of sleep has been associated with memory problems, lack of ability to concentrate, and poor academic performance. Being sleepy during the day can result in lack of concentration that results in inattentiveness or wandering mind, making it difficult for you to follow and comprehend lectures. Research studies have shown a relationship in students who report a lack of sleep time with lower than average overall GPAs. Daytime sleepiness has also an effect on mood and psychological problems. People who do not get enough sleep tend to have higher rates of depression. Drowsy driving with poor reaction times can be very, very dangerous. In another study, it was shown that having 1 to 2 alcoholic drinks, which is common for college students, combined with less than 4 hours of sleep, was shown to increase the risk of car accidents by an average 23 to 33%. Other implications of daytime sleepiness include increased risk-taking behavior due to poor ability for critical thinking and judgment, impaired social relationships, poor health, and immune system dysfunction. Also, people who do not get enough sleep tend to have increased risks of obesity due to hormonal changes that are associated with those disrupted sleep patterns. Sometimes sleepiness results from just not being able to get to sleep or not enough hours in the day. Cramming for examinations and missing sleep most likely will not result in better academic performance. Instead, it creates difficulty comprehending the questions or directions and problems with memory recall. Cramming for tests isn't the only reason college students miss out on sleep. Sometimes it's due to an excessive course load, work or financial responsibilities, high personal goals or need for overachievement, social obligations, disproportionate focus on exercise, environmental disruptions, or sometimes just being a night owl. Let's talk a moment about insomnia, which is the most common reason for daytime sleepiness. Insomnia can be trouble getting to sleep, staying asleep, or an intermittent sleep pattern where you wake up often through the night, preventing a good night's sleep. There are many causes for insomnia, most of which are shown on this slide. I'm not going to read them all, but I would like to point out several that are more common in the college population. Stress and anxiety is the #1 reason, and that results from constant worrying about getting assignments done, keeping grades up, paying bills, and things like that. Consuming alcohol right before bed can cause early awakening and prevent restful sleep. Stimulant use like caffeine or nicotine are fairly common in college, and effects can last for hours, making it very difficult to go to sleep. Eating large meals late at night can lead to gastroesophageal reflux disease and heartburn. When you lay flat, those symptoms become worse. If your sleep is disrupted more than a couple times a month because of frequent headaches or pain for any reason, you should seek a medical evaluation. It is not typical for young adults to have chronic pain conditions. There are some simple things you can do to help prevent episodes of insomnia. First, organize your life. Schedule time for rest, meals, exercise, studying, social time, and work around your class schedule. Avoid working or studying while in bed. Instead, study in the library, at your desk, or another quiet place. Although it's tough in a dorm, try to avoid a lot of TV while in bed. Make bed a place for sleep and try to establish a consistent bedtime. Avoid eating or drinking, especially caffeine or alcohol, right before bed because they are known to disturb sleep. Your normal sleep-wake cycle can be improved by setting a consistent time to get up and to go to bed. It seems silly, but exposure to natural light helps your body maintain the normal sleep-wake cycle, so try to get your exercise outside. Exercise releases chemicals that help you relax, control stress, and sleep better. Just don't do it right before bed, and don't overdo it. Control your environment as much as you can, keeping your room quiet and dark while sleeping. Last but not least, try relaxation techniques. Take a moment to just quiet your mind. If you find you're sleepy during the day, it's okay to take an occasional power nap, but try not to do it routinely and don't do it close to your normal bedtime. Try not to make up for lost sleep by sleeping longer on the weekends. Again, altering normal sleep patterns messes up that normal sleep-wake cycle and causes disruptions in your ability to go to sleep or stay asleep. Let's face it, roommates can be difficult. Try to be courteous to your roommate and discuss ahead of time when you would appreciate a quiet environment. And it works both ways. Keeping your roommate up and being discourteous will not improve relationships and generally will create tension, irritability, and anger. So let's talk a little bit about what isn't typical insomnia, or when you should be concerned about daytime sleepiness. There are some medical conditions, some of which can be very serious, that have a result in chronic daytime sleepiness. They're usually classified into 4 categories: sleep-related breathing disorders, central nervous system disorders, restless leg syndrome, sleepwalking, talking, and night terrors. Sleep-related breathing disorders are disorders where you either stop breathing intermittently or breathe too shallow, not providing your body with enough oxygen. Central nervous system disorders can be narcolepsy, where you suddenly drop off to sleep without awareness that you're tired or falling asleep. Idiopathic hypersomnia is constant sleepiness without an explainable physiologic cause. This means it's not from lack of sleep or from a known cause or event. Post-traumatic hypersomnia is generally an increased need for sleep associated with head injury or brain infection. Restless leg syndrome is a twitching or uncomfortable feeling in your legs which can prevent you from going to sleep or wake you after you've already gone to sleep. The cause of this syndrome is unclear. Sleepwalking, sleep talking, and night terrors have to do with disruption or abrupt arousal during a certain phase of the sleep cycle. This is much more common in children, and most of the time they grow out of it, but it can occur after periods of sleep deprivation. The symptoms that you may have a medical disorder and should seek medical care include these: excessive daytime sleepiness. This is not an occasional sleepiness, but most of the time you feel like you need to go take a nap. Loud disruptive snoring, which I'm sure your roommate will let you know happens. Most people are unaware they snore. Wake up choking. Apnea is the medical term that means you stop breathing. In sleep apnea, gasping for breath or the tongue dropping back into the back of the throat triggers a choking type reflex that often wakes a person. If you feel more rested after sleeping in a reclining position rather than laying completely flat. You unintentionally fall asleep in inappropriate places like class, while eating, or in loud areas like ball games or sports arenas. If you can't stay awake while driving frequently. Now, this isn't just episodically, which most people have experienced, but this is on a frequent basis. Having that twitching, uncomfortable feeling or involuntary jerking of your legs when you are lying down. If you have any of these symptoms, it is recommended that you get a good physical examination and discuss these issues with your primary care provider. Here are some web links and short videos if you would like some additional information. So after watching this, I hope you see that there are important reasons for you to get your sleep. Keep a journal of your sleeping patterns for 1 week and turn it in with your hours for 5 extra points in the Biggest Changer competition. Here's a list of my references for this presentation. Thank you, and go get some sleep.